Good morning, everyone. Thank you very much for joining us as we begin the Brain Health Series brought to you by Teachers College Motor Control and Motor Learning Program, Columbia University Medical Center, MPAC, and Kusudi International. It's with great privilege that I introduce two advisors to me, actually. I'll start with Dr. Johnny Greene, who is the pastor of Mount Nebo Baptist Church. He will welcome you and also give you a little information about our goals and the importance of us having these community engagement series meetings about improving our health and our brain health specifically. Thank you, Pastor Greene. I'll turn it over to you.
Good morning, everyone. I'm Pastor Greene of Mount Nebo Baptist Church in the village of Harlem. I'm also the president and CEO of MPAC, Mobilizing Preachers and Communities, an organization consisting of 150 churches throughout greater New York City. And several months I was approached by Dr. Mincer and her colleagues at Columbia University regarding the brain health seminar, and it immediately struck a chord with me, being keenly aware of all of the issues that we experience in the African American community that's related to brain health dysfunction, brain health and injury, etc. I felt it incumbent upon me to get involved, to see from a community standpoint, from a religious standpoint, as a leader in the African American community. I thought it was important that I partner, that MPAC partners with Dr. Mincer and Columbia University on this brain health series. And we're hoping that what is ascertained from our time together, the research that the professionals have done, and all of the learning information will be disseminated in a way that it will be beneficial for our community and New York City and others around the country. So I'm glad to be a part of this brain health series, and MPAC is certainly excited to partner with Columbia University and Teachers College and Dr. Mincer in this project. Thank you for coming and being a part of it, and I hope that you will benefit greatly from your participation.
Thank you very much, Dr. Greene. We appreciate this honor to be able to share with you and to collaborate with you as we talk about some of the very important issues that affect our community. Now I'm going to turn it over to Dr. Lori Quinn. Dr. Lori Quinn is the chair of the Biobehavioral Department in Motor Learning at Teachers College. She has extensive research experience in working with individuals with Parkinson's disease, Huntington's disease, as well as children with neurological disorders. So I will turn it over to her. She is actually also my doctoral advisor at Teachers College. So I get the privilege of working and learning from her on a regular basis. So Dr. Quinn, take it away. Thank you for providing this lecture today.
Thank you so much, Nia, and thank you, Dr. Greene, and thank you everyone for joining us. We are really excited to begin this partnership and this adventure, and we really just hope this is the beginning of a conversation that we can all have together. And while I am going to be presenting, about a 15 or 20-minute talk, I do really want this to be as interactive as possible and have an opportunity at the end for us to have a discussion about what some of the implications of the things that I'll be talking about today are. So I'm going to start by sharing my screen. And okay, so everybody can see that, yeah? Joel, can you, yeah, good, thumbs up, great. So the topic of today's talk is brain health. What is it and how do we maintain it? As Dr. Mensah had suggested, we're starting this off as a brain health series that we'll be presenting once a month over the next few months. So I'll be starting off today providing a bit of an overview about brain health with a specific emphasis on exercise, because that is the work that we do, and the research that we have done is largely focused on exercise. But I'm going to try to give sort of a big picture overview about the concept of brain health and why it's important. Nia is going to be speaking in January on harnessing our community to decrease health disparities, which is a really important initiative that we have at Columbia, and that we really want to, again, try to partner with all of you to think about ways that we can decrease health disparities. And then we'll be having a talk in February on knowing the signs and symptoms of a stroke, which is one of the most disabling conditions, neurological conditions for individuals. So who are we? Well, I am, first of all, a physical therapist. I am incredibly proud to be the director of the Neurorehabilitation Research Lab at Teachers College. And these are some of our students pre-COVID. We have new students who have joined in. We need to take a good Zoom picture at our next get together. But we also collaborate very closely with Columbia University Medical Center and Dr. Hiral Shah, who is pictured here at the top, who is a neurologist in the Movement Disorders Center. And Nia has really been leading the charge with this brain health series. So what is brain health? When we think about brain health, we think about many different components about what makes our brain healthy and able to function optimally. When our brain is healthy, it has blood flow required for peak performance. A healthy brain is essential for living a long and full life. And when your brain's healthy, you're better able to pay attention, to solve problems, communicate, and much more. Another important component of brain health is the prevention of neurological diseases and disorders. So when our brains are healthy, we are optimally functioning. But when our brains have some level of disease or disorder, then we have a lower level of functioning, and we can experience things like depression or anxiety or fatigue, memory loss, a whole range of cognitive problems. And these can be manifested in some of these individual symptoms, but they can also be part of larger neurological diseases like Parkinson's disease, Alzheimer's disease, various kinds of dementia. And literally there are literally hundreds of neurological diseases. I work with a lot of people who have Parkinson's disease and Huntington's disease, which is another type of neurological disease. And what we have been really trying to push is thinking about ways that we can ultimately help to prevent these diseases. Certainly, medication and pharmacological interventions are essential to this, and there is an incredible amount of work and resources that are being dedicated to this. But in the absence of cures for any of these diseases, which unfortunately at this point still seems somewhat far off, there are lifestyle interventions that can be used to augment medical or pharmacological interventions. And that's what I'm going to largely focus on today. So the fact that lifestyle has a profound impact on brain health is something that we didn't always think about, or we didn't always know. We knew that maybe eating well or having good medical health was important for cardiovascular fitness or maybe for preventing cancer. But this concept that these lifestyle factors can improve our brain health and potentially prevent disease is a relatively new concept. And really just over the last, I would say even 10 years, there's been an incredible amount of research that has supported this concept that lifestyle can actually affect brain health. So the concept of food and nutrition, medical health, sleep and relaxation, mental fitness and agility, and social interaction all play into this concept of lifestyle. What I'm going to be focusing on today, again, because it's our area of research interest, is physical, the concept of physical exercise. But I do want to, and I'll probably be coming back to some of these, especially things like mental fitness and social interaction, as being really essential components that can feed into importance of brain health. So the good news about this is that we have some level of control, that lifestyle interventions or lifestyle factors are things that are largely under our control. There are barriers to them, and that is something that I do hope we can have a bit of discussion about. You know, if we could all just exercise, you know, it would be really, really great. It would have many benefits, but it's often very difficult for people to engage in exercise, and there are barriers to that exercise. So there's one very famous saying that I like to say, which is something that was reported by the former director of the National Institute of Aging at NIH, who said, if exercise could be packaged in a pill, it would be the single most widely prescribed and beneficial medicine in the nation. So if it was easy as taking a pill, in many ways, exercise would, I think, be something that could be extremely beneficial, and it is. But there are often barriers to engagement, and we'll talk about that a little bit. But let's get back to why exercise. Why do we think that exercise is so beneficial to the brain, right? We know that going for exercise, maybe it might help to reduce, to increase our muscle strength and reduce sort of atrophy that might happen. We've known for a long time that it helps our heart, that prevents heart attacks. But why might it actually be beneficial to the brain? Well, some of this research comes from animal models. A lot of the research that is done both in pharmacological and other interventions have focused on animal research. They have their underpinnings and understanding what happens in animals, and then we bring that over to human studies. So in animal studies, unlike in human studies, you're able to actually force animals to do exercise. So you put them on, on a treadmill or a hamster type of a wheel, and they just exercise a lot. And in those animal models, it has been shown that animals who had engaged in that forced exercise had improvements in cognitive tasks, and they had improvements in very specific areas of the brain that are crucial for memory, an area known as the hippocampus. There's also been studies that have shown that there are increase in a release of what are called neurotrophic factors. These are proteins and factors within the brain that help to produce new synapses, new connections within the brain. Again, this is something that's also relatively new, over the past 20 years, that we've just started to realize how plastic, how adaptable our brain actually is. And it is adaptable based on the inputs that we give it. So the exercise, the activities, the things that we do help to form these new neural connections. And so exercise really helps to drive some of those neural connections. So exercise improves brain function in many ways. It improves heart and lung function. It improves attention and executive function and memory in healthy older adults. It improves memory, executive function, and balance in people with Alzheimer's disease. And there's been shown improvements in working memory, processing speed, and visual learning in people with depression. So again, let's come back to this concept of neuroprotection. What is neuroprotection? We talk about the concept of preventing things, right? Preventing neurological diseases or disorders. So exercise can be neuroprotective. It can help to protect some of the neural structures within the brain. And it does this through, largely, there's a protein called brain-derived neurotrophic factor. And this helps to provide some of the support for some of the plasticity effects that we see from exercise. So this factor helps to support the health of existing neurons. It encourages growth of new neurons, this concept of neuroplasticity, and it's very important for learning and memory. So exercise increases BDNF levels in healthy adults and in people with neurological diseases. So we know that in people with neurological diseases, if they exercise, they increase their levels of BDNF, and that can help to provide new neural connections that might help to compensate for the areas of the brain that are damaged from Alzheimer's disease or Parkinson's disease or dementia. But in healthy adults, having that excessive amount of BDNF and continuing to have some of those neuroprotective factors present might be helpful to prevent or delay the onset of some of these neurological diseases and disorders. And how does it do this? Again, this is just a graphic example of what I have been discussing, but we have this concept of exercise, which I'm going to go into what constitutes exercise, but practicing skills and aerobic exercise. It improves those synaptic connections, and it also improves our overall brain health, those trophic factors, increasing the blood flow, improving our immune system responses. And then that helps to drive certain circuitries within the brain. And these are areas within the brain that are critical for our cognitive functioning and our motor functioning. And that helps to improve our behavior, our motor abilities, our cognitive abilities, and really importantly, our mood and motivation. So exercise can enhance our mood. This is something that as individual, really anyone can have impairments in mood. And I do have to say in COVID times, we certainly know that the research is showing that there's an increase in mood disorders and anxiety and depression. And because of restrictions of being able to go out in the ways that we typically engage in movement and exercise, we know that people have shown increases in depression and anxiety. So exercise can enhance our mood, and studies in the general population of aging adults show that exercise can decrease depression and anxiety. And in some studies, exercise has actually been shown to be as effective as antidepressant therapy for depression. The really important point is that the more vigorous the exercise, the greater the mood impact. And this concept of vigorous, or how hard you exercise and what result that has, the research is really pointing in that direction, that an increase in vigorous activity can really help to improve outcomes in a wide range of factors, from mood, cognition, and motor function. All right, so you might be asking, so what do I do? What is the best exercise? The best exercise is the one that you will do. And I'm going to go through a couple of different examples of kinds of exercises and provide a bit of an overview. But in our lab, we spend a lot of time really thinking about ways that we can help people individually engage in exercise that they like to do, that's meaningful for them, but that does have an evidence base to it. So that is supported by some of the research, but any exercise, any sort of movement will be helpful. With thinking about the overriding concept of moving more and sitting less. And sometimes when I am sitting at my desk right here and spending a lot of time on Zoom calls and work, and I have to think about this mantra. I actually think I should post it somewhere, because we need to get up, we need to move, and for physically our joints, but you know, really the emphasis here is it is actually beneficial for our health and may help to prevent diseases. We use this activity pyramid when we work with individuals who are helping to coach on activity programs, to give a nice graphical representation of what kinds of activities you should be doing or ideally could be doing, and how this looks in a given day. So in a given day, you want to be spending a lot of time down here at the bottom of the pyramid, which is this concept of moving more and sitting less. Now, we have here an aim for 10,000 steps per day, and I don't know if anyone has heard about this or read about some of the studies that have talked about the number of steps you should take in a day for optimal health. I'll have to say that that number of 10,000 is being, I think, reworked and rethought a lot. I think it's certainly a reasonable number to attain, but I know people who have a really good level of fitness and health who have a lower level of steps than that. Some of the ways that you can measure steps are there are some wearable devices, so Fitbits or monitors, and most smartphones really now have a health app that can track your steps. So simply by carrying your phone with you, even in a bag or in your pocket, it can reasonably count the amount of movement that you have in a given day. But other things like walking the dog, you know, taking the stairs instead of the elevator, parking a car further away from the shops, looking for opportunities to move rather than looking for ways to not move, you know. So I always think, oh, let's get a you know, spot really close to the shop that I'm going to. Well, park a block or two away, and maybe that will be easier, or get off of the bus or get off of the subway a couple of stops earlier so that you can get in that exercise. Another component of this that is important in, several times a week is looking at aerobic exercise and recreational sports, leisure activities, and exercises to strengthen and keep your body flexible. And at the top of the pyramid is sitting sparingly. So sitting the least amount, or at the very least, breaking up those periods of sedentary behavior. There have been some public health advertisements that have talked about the fact that sitting is the new smoking. That the amount that we sit is really can be as detrimental to our health as smoking has been shown to be. So I don't know if that has been fully parceled out in the research, but I sometimes like to use that as an analogy to show how important it is to be moving and to minimize our sedentary behavior. What type of exercise is best to do? I'm going to just give you this quick overview because there are two concepts, and maybe I'll just kind of step back about this. There's exercise and physical activity are often terms that you might hear used interchangeably. Physical activity is really the broad term of any kind of exercise or activity or movement that uses kind of your muscles and your body sort of in a volitional way. But exercise is structured, right? So it's a structured way of doing physical activity. Sometimes people hear the word exercise and it's like, oh, exercise, I don't like to exercise. I think it's a lot about reframing what exercise actually means. But within different types of exercise, we have these four components, which are aerobic, resistance, flexibility, and neuromotor. And we have, there's been a lot of research and there's some specific recommendations of how we should be incorporating these into our daily life. And these are some examples of what each of those entail. So aerobic exercise is where you're getting your heart rate up, right? So going cycling on a treadmill, doing aerobics class, boxing, anything where you're basically breaking a sweat. Resistance training is where you're strengthening muscles, either individually or as a group. Flexibility are things like yoga and Pilates, but just even stretching your muscles and your joints so that you can have a good range of motion. And neuromotor is balance. And this is one thing that I think people don't often pay enough attention to. And it is essential as we age and as a component of prevention and management of neurological and neurodegenerative diseases. And I'm going to talk specifically about aerobic and balance just a little bit. So you might be asking, well, what do we do? How, what access do we have to different forms of exercise? There has been a huge push. I think one of the, I'm hesitant to say benefits, but maybe benefits of the COVID pandemic has been the increase in access to videos for people who have for elderly individuals or people with Parkinson's disease. There's a wide range of videos and exercise programs that are available online. And I have a list of those at the end that I can share with everyone. Going out for walks and using, these are certain kinds of walking sticks or Nordic poles that can be used to increase your heart rate as you walk around and also help with balance. And again, there's just a wide variety of videos and exercise programs available online. But the important thing, getting back to the research, is we have to do this with some level of intensity. And we have to try to get at this somewhere between at least a minimum of 4 to 6. So where you're looking at moderate or vigorous levels of activity. And this is just a really nice, simple scale that looks at how hard am I working out? And 1 is very light, which is basically what we're all doing right now, is very light. You don't really notice you're breathing too much, you're not exerting much energy. And 10 is maximal effort. I feel completely out of breath. I cannot possibly keep going. And what you want to be thinking about is exercise at this moderate to vigorous level where you can certainly feel that you're breathing heavily, but you can hold on a short conversation, right? You don't want to be completely out of breath. As you start to move into vigorous or very hard, it's not, you're typically not able to sustain that level of activity for too long, but you can do short bursts where you get into that vigorous or harder level of activity. All right, so I'm just going to talk quickly about balance exercises as being another really important piece. I sort of said that I think it's something that we tend to neglect, but balance is such an important part of preventing falls, as well as, again, driving that brain health. So thinking about those neural connections. And one of the best exercises or activities, I should say, for improving your balance and kind of having this really comprehensive effect is dancing. And dancing is something that is so powerful because you have balance, you can have strengthening, it can be aerobic. I know when I dance, it definitely can get out of breath. And the music, there's a whole host of literature about how beneficial music is on engaging our brain systems and engaging our ability to move and improving our ability to move. And so I would really encourage all of you to think about, you know, dancing and movement and anything that might help to challenge and work on balance in that way. So just to kind of move towards our summary, some of the things that we want to be thinking about is that we have to be safe first and really make sure that our environments are safe. One of the things that we just did in our lab yesterday is put together some handouts for people about how they can make sure that their environment is safe when they're exercising at home. So that's something that we could share with all of you. Considering working with a physical therapist or possibly even a trainer who has expertise, going to see a physical therapist within your local community hospital or nearby who might be able to get you started on an exercise program that could be carried over. Getting an activity monitor or using phones that many people have to be able to monitor activity. Changing things up and picking things that you enjoy, right? Again, the best kind of exercise is the exercise that people will actually do. And I like to think about exercise as a prescription, similar to, again, taking certain medications. It is an essential component of maintaining our health and in particular our brain health. And the components of that are important are elevating your heart rate, breaking a sweat, and doing enough to feel fatigued, but not exhausted or in pain. So I know you probably won't be able to write these down quite yet, but we can share this information with individuals. But I just wanted to say that YouTube has some really amazing videos. I would say if you go to the National Institutes of Health, they have links to some of these videos that are, I think, some of the best ones that are out there. And also, we do a lot of work in Parkinson's disease, but some of the videos in the Parkinson's Foundation are excellent resources as well. So I think I just kind of wanted to open it up right now to have a conversation for people to have the opportunity to ask questions, and we could maybe talk about what we see potentially as some of the barriers, and maybe also talk about just more general aspects of brain health. But thank you very much for your attention.
Thank you very much, Dr. Quinn. So we'll take questions in the chat, or feel free to go ahead and announce yourself and ask the question. I will get us started. Dr. Quinn, what do you do if I'm starting to notice my family member is forgetting certain things, or starting, I notice a tremor or a shake of their hand when they're writing? What are some things that we should do when we see that in our family member or friend?
Yeah, that's a great question, Ian. It's really important for identifying some of those symptoms that could be indicative of a more complex neurological disorder or problem. So let me just go through maybe what some of those symptoms might be, because I think you identified some of those. So it would be things like tremor. It would be memory loss. Memory loss is something that happens as we age, but there are a certain level of memory loss that can be concerning. And I think what the important thing is to identify if there's been a change in that pattern of memory loss. So the important thing, and movement, right? And potentially someone slowing down with their movements and changing the way that they move around and their abilities. So the first thing that we would recommend is for an individual to first probably see a medical professional that they feel comfortable with. So their primary care physician or someone in their community who they feel really comfortable with. But then we would quickly recommend a referral to a movement disorder specialist or a neurologist. And at Columbia, we have a great team of neurologists who this is exactly what they do, and try to help to be able to determine if the symptoms that individuals have are part of normal aging or something that might need to just be watched over time, or that might be indicative of a more significant condition. And why is it important to get that early intervention? Well, it's really important because there are medications that can help, really, from everything from now dementia to some degrees to Alzheimer's disease. There are some symptomatic interventions. Certainly in Parkinson's disease, we know that the earlier intervention, the better in terms of outcomes. And again, engaging in all these comprehensive lifestyle factors will even take a more important urgency if a neurological disease is present.
Thank you. We have a question in the chat. Are standing desks, treadmill desks, or under desk pedals helpful for people with desk jobs?
Oh, that is a great question, and absolutely. So I'm going to talk about a little bit about that. So the important thing is, even with standing, so I don't know if anyone has ever tried to stand a lot when they were doing work or have a standing desk. It is about the changing of positions. So standing in and of itself is good because it does help to sort of that increase in weight bearing is actually helpful for your bone structure, and there's a form of strengthening. But even standing for a long time can be very taxing, and in some ways is sedentary in and of itself. So it's the idea of not staying in any one position at a time. So maybe setting a timer on your phone or on your computer to say, okay, every hour I'm going to get up and move. But those are, I think, really helpful. A treadmill desk, I think, would be fantastic. It's a way of moving while you're working. I don't know about under desk pedals. I'm not sure what those are. I don't know if Julie or anybody knows what under desk pedals are.
I believe
they're just like the foot ergometer.
Oh, right.
Pedal
Okay.
ergometers.
Oh yeah, those are great. Yeah, really good. So we really recommend any kind of like an exercise bike or cycling is a great way to get an increase in your heart rate. And those under desk pedals really do help to do that. So again, another important component of that with sitting is blood flow, okay? So it's something we didn't really talk about, but diabetes is also a huge risk factor for some people. So making sure that we have increased blood flow and encouraging that blood flow to return back to the heart. When we sit and our legs are in that dependent position, the blood can pool and it can result in a lot of complications and problems. So I think those under desk pedals are a great idea.
We have another, thank you, Dr. Quinn. We have another question from Mrs. Marquita Allen Howard. Is there a specific heart rate goal I should look for when exercising to know that I am giving my heart a good workout without overwhelming myself?
Oh, that's like a planted question. I love that. That's really, really good. So I showed that the scale of 1 to 10 to give you an idea of what the heart rate is in terms of how you're feeling, which I think is important. But within your heart rate, yes, absolutely there is. And I'm going to give you a quick formula for figuring this out. It's not perfect, but it gets you into the ballpark. So you take the number 220 and you subtract your age. That number is your maximum heart rate, right? So if I was 50 and I subtracted 220 from 50, I get 170. So that is, if I went on an exercise bike or went into the hospital and did a stress test, probably the maximum that my heart could get to would be about 170. I'm a little bit older than 50, but that's okay. So that gives you an idea of what you're working as hard as you possibly can. Your heart just literally physically can't pump any further than that. What the research has shown is that when you're exercising in that moderate to vigorous intensity, you want to be at about somewhere between 65 to 80 to 85% of that maximum heart rate. So you can just simply take that as a percentage. And some of my lab members, I know that we have I think we have a table where we show this, what those different values are at different ages, what your maximum heart rate range should be. But it's a relatively simple calculation. So generally somewhere between, I'm going to guess like 130 to 145 would be a good range if you're around 50. So it's looking at a percentage of your maximum heart rate. Now, typically, right now, our resting heart rates are somewhere between probably 60 and 80 beats per minute, right? So getting it up to 120 or 130, you can imagine you're really working hard. But even if you get it to 100 or 110, you might be working at a lower level, or it might not fully get to that aerobic exercise, but that is still increasing your heart rate. So what I would say is it's important not to get discouraged if you're feeling like, oh gosh, that's a lot, it's really heavy exercise. You can work your way up to that level of intensity. Thank you, Nia.
No problem. I did want to ask you the best way to have anyone with questions or concerns. What would you recommend to be the best way to reach out to the professionals at the Columbia University Medical Center?
Yeah, I mean, I would certainly say they can just email us or email the lab. Do you want to maybe put the lab's email in the chat box? We can certainly do that. We're all very open to responding to emails, and then we can get people to the right individuals to help. So part of what our lab does is we work with individuals to help to develop specific exercise programs and plans. But an important component is improving access to care and improving early access to both rehabilitation services as well as the Movement Disorder Center, if people, as Nia had suggested, are noticing specific signs and symptoms.
So I'll include, and I thought about Ms. Delaney as well, the social worker at, should I include her information? So I'll put her information.
Yeah.
Because
so Elizabeth, yeah,
she's good. If anyone needs to have a evaluation, to see a neurologist, or you just need a direction on which professional to see, you can start with the social worker there. I'm going to add the lab information, but I think we just had a quick question that came from Mrs. Jackson Diagni. Does this support require insurance?
Yeah, so access at Columbia can be, I know they accept a wide range of individuals who have both insurance and also who might have Medicare or Medicaid. At our center, we only do research, and we don't take any insurance. So a lot of the work that we do is supported by grants and funding that way. So, and I know that there's a lot of programs at Columbia that that is the case as well. So I think not having insurance should not be a barrier to access to care.
Great, and I think we have another question from Mrs.
Virtual.
Yes,
yeah.
Cuddy.
So about virtual appointments, yes. Again, I will say one of the potential benefits of the COVID pandemic has been this access and the improvement to telehealth services. We have had just have had to literally figure out how to develop and deliver telehealth services in a way that we would never have been able to do, I think, without this sort of being forced into this situation. Telehealth has been around forever, but there was just a lot of barriers to uptake, and one of them was insurance. But now we have the ability to have insurance pay for telehealth services in the same way they would for regular doctor's appointments or regular therapy appointments. And we are all fighting very hard to make sure that that is that's maintained so that we can continue on with telehealth services. All of the services that we have done now have been completely telehealth since March. And we found it to be, I think, a very nice way to interact with people and to have access to people who might not have been easily able to come to the Columbia Center or might not have wanted to travel. So that, I think, is something that is here to stay.
Great, thank you so much. And then I had one more question about
Yeah.
resources available. I know you're working closely with some projects at Columbia to help individuals with Parkinson's disease. I didn't know if you wanted to share a little bit about the projects that are going on and some of the resources if there are individuals that we know that have Parkinson's disease and in the early stages that we could maybe get them in your hands or your colleagues' hands so that they can get some available services, whether it's telehealth, exercise training, consultation, maybe even access to iPads if they don't have, computers to be able to engage and help
Yeah.
strengthen brain health.
Yeah, thanks for pointing that out, Nia. So we have two initiatives that we have been working on at Columbia to try to increase access to services, telehealth included. And a big push for us is working with people who are relatively newly diagnosed with Parkinson's disease. One of the difficulties, and I know Nia is going to touch on this in the January lecture, in terms of health disparities, is that we know that the African Americans tend to get diagnosed with Parkinson's disease and many other neurological diseases at a much later time than other individuals are. And that really results in a lot of issues because it is that access to care early in the disease process that can really set people on the right path for managing the course of the disease. So at Columbia, we have one program called Engage. We have a couple of different components of it, but the Engage PD program is designed to work with people from the very earliest stages to help them to manage their disease most effectively and thinking about these lifestyle factors and thinking about exercise. We also have, again, access to really world-class neurologists at Columbia who we partner with in these programs. And it would be really important to, again, have access and to see a movement disorder specialist from very early on in the disease. And we are partnering, I think, as Nia sort of alluded to, with different local organizations to try to see what the barriers are to engaging in telehealth. If people do need iPads, if there's connectivity issues. One of the things that we had thought about pre-COVID was having, and I know that there are places like this, but having centers set up either at community organizations, maybe at churches, where people would come for their telehealth appointment, right? So if they didn't have access within their own home, whether it was Wi-Fi issues or having access to the computers or an iPad, that they could go to a community center where we had the telehealth set up. So those are some of the things that we are looking to help to partner with community organizations on.
That sounds great. I can see Mount Nebo being a center for telehealth access in the future once we get through the pandemic. But I do have one more question, and I'm going to repeat it because I do know we have people on the phone. So this comes from Dr. Erica Dillard, who will be actually doing our third series lecture on signs of a stroke, which she's a MD, PhD, neurologist, neurosurgeon actually in her training. So her question is, I have found it difficult to encourage family members to exercise, particularly those who are older and have had long-standing immobility due to previous injury or stroke. How would you recommend encouraging them to start the process that is not overwhelming to them? Great question.
Really great question. It's something we spend a lot of time thinking about. So I think one of the most important things is to meet the individuals where they are, right? You can see that in the lecture that I presented, there's sort of these pie in the sky, like what people should be doing and all of these great things. But giving people who are at that level, that information can be overwhelming. I think you're right. And it might actually backfire. It might actually be, well, I'm never going to be able to achieve that. So one of the things that we like to do is start very small and think about one thing. A big part of what we do is we do goal setting and think about one goal that you might be able to achieve that would increase your activity level greater than what it was the week before. And that could be just as literally as simple as you're going to do this maybe 5-minute exercise video or 10-minute exercise video, or you're going to go for a walk around your block just one day a week. Really set very attainable small goals that are maybe not at all what you would think would be an ideal type of a goal, but just really minor so that the individual can develop some level of success. And the other thing that I'd like to say, which I think is really important, is having stories to share of people who have been successful and matching people up with stories that they can relate to, right? So finding other individuals who have had some success, who might have had similar mobility issues, and they could share their story. There's lots of examples of this on YouTube. We have some individuals who we work with who have these really great stories that are even willing to talk to some of our newer participants or people newly diagnosed, but even watching videos of people who've had success. I think hearing stories of people that they relate to and really being at an individual's level. And then the last thing I would just say is really trying to understand what the barriers are to engagement and exercise. And again, trying to help to overcome those barriers and working very collaboratively. It does take time. You know, it's not just, one of the things we've been emphasizing is it's not just, oh, exercise, it's really important. We are treating exercise as a really serious, really important intervention that needs support, right? It needs guidance by experts who have an understanding of the really essential components of exercise. So it's a great question, Erica. No,
Thank you again. So I just want to thank you again, Dr. Quinn, for joining us and actually helping to spearhead this brain health series with me and Dr. Greene. Before we close, I just want to thank all the participants, and I would like to turn it over to my pastor, Dr. Greene, to close us out. And again, thank you again. We do hope to see you January 13th at the same time, 11 a.m. Wednesday. We try to keep it to an hour because we know everybody has Zoom, is maybe zoomed out, but I just want to thank you for your time and for every participant. Shout out to Mount Nebo Baptist Church and all my sisters and brothers on the call and my TC family and Kusudi International. Dr. Greene, take it away. Thank you.
Thank you, Nia. Thank you, Dr. Quinn, for your most helpful lecture. The information that you have shared with us has been most helpful. And I'm sure that the individuals who joined us today, and hopefully in the next two seminars that we have, we'll even have greater attendance. I'm happy to have our General Secretary of MPAC, Dr. Patrick Young, who joined us, who pastors in East Elmhurst, Queen. But it is so vitally important that we partner with organizations like Teachers College. It's so, and Nia, I want to say that we're so proud of you for the work that you're doing at Teachers College as you are pursuing your academical success. But this is something that impacts the African American community, our community in particular, in a great way. And the inequities with regards to health care and just the lack of knowledge. You know, there's a passage in the scripture says our people perish for a lack of knowledge, not just in a spiritual sense, but in a physical sense. We miss out on so much because we don't have knowledge, and without that knowledge, without understanding, sometimes people in our families, people in our congregations, people in our communities are suffering brain health issues, Parkinson's disease, etc. And because they don't identify the signs early, they don't get medical attention. And then the issue with the disparities in healthcare prevents a lot of our people from getting medical care. So these seminars are going to be helpful for those of us in the communities, in our communities who are helpers. This will be some valuable information, and as many of you as can, if you can get the word out, help us spread the word, because the next two seminars are going to be of utmost importance that we be a part. So we're glad to partner with Teachers College. We're glad to be a part of this as an organization. We want to make sure that the information that we're receiving today and in the next two seminars
gets disseminated to all of our pastors and churches in our organization. And hopefully, as the word spread, as the information goes forward, many, many people will benefit from this. So thank you again.
And on that note, thank you and enjoy the rest of your afternoon. Be well.
Thank you, everyone.